Hello students, today we are going to discuss about one of the parasite known as Ascaris lumbricoides. So this Ascaris lumbricoides, it comes under the categories or classification of nematodes. We have different classification for this helminths like cestodes, trematodes and nematodes. So this Ascaris lumbricoides, it comes under nematodes. So this parasite, it is commonly called as roundworm of man, or the common name is known as roundworm. So it is one of the largest parasite of the intestinal nematodes parasitizing human, and the most common worm found in human. So worldwide it is distributed worldwide and most prevalent in the tropics, subtropics and mostly in the countryside. So the name lumbricoides is derived from a Latin word lumbricus, meaning earthworm, being of its resemblance. So in morphology we are going to discuss about the adult worm, which includes the male and the female and the eggs. So these are the two morphologies most commonly seen. So in adult worm, they live in the small intestine of infected person. They are cylindrical in shape with tapering ends, the anterior end being more pointed than the posterior, and the mouth at the anterior end has 3 denticulated lips, 1 dorsal and 2 ventrolateral. And if you see the color, they are pale pink or flesh colored when freshly passed, but become white on standing. So they have a complete digestive tract. This is the general characteristics of the adult worm. So in case of the male, if you see the picture or the diagram, the male adult worm, it measures around 15 to 30 centimeter in length and 2 to 4 millimeter in thickness, curve posteriorly and carries copulatory spicules. So that is for the male. Then for female, it is 20 to 40 centimeter long and 3 to 6 millimeter thick. So the posterior end is straight and conical, and you will see the vulva is ventrally located at the posterior part of the anterior 1/3 of the body. Then you will see a distinct groove. The vulvar vase is to facilitate mating and is seen at the vulvar opening, and the single worm can lay up to thousands and thousands of eggs per day. Then after this they lay eggs, the eggs will be passed in the feces. So that's for the adult worm of both the male and female. So the next morphology we have here is the egg. There are 3 kinds of eggs. Here we have fertilized egg, unfertilized eggs and decorticated eggs. So the first picture, if you can see, it is a fertilized Ascaris egg, and the next is the unfertilized Ascaris egg. So the fertilized eggs, they laid by inseminated females, and they are embryonated and develop into the infective eggs. Okay, and they are spherical or ovoid in shape, bile stained to golden brown color, and it measures around 60 to 75 micrometer in length and 40 to 50 micrometer in breadth. So they are enclosed in a shell consisting of 3 layers, that is outer mammillated albuminoid coat, then thick transparent middle layer, and the inner lipoidal vitelline membrane. So this fertilized eggs contains a large unsegmented ovum, leaving a clear crescentic area at each end. So that is for the fertilized egg. Coming to the unfertilized eggs, they are laid by uninseminated females, these are non-embryonated and cannot become infective. Then the egg is longer, up to 90 micrometer and more elliptical, and the shell is thinner with the outer coat scanty and irregular. So if you see the ovum, it is atrophic. Okay, that is for the unfertilized egg. So we have decorticated eggs. Okay, decorticated eggs, they are both fertilized and unfertilized eggs. Sometimes may lack their outer mammillated coats and are colorless. So that's all about the egg. And coming next is we have the life cycle of Ascaris lumbricoides. So out here, the fertilized egg passed in feces is not immediately infective. It undergoes a period of incubation in soil before acquiring infectivity. So the eggs are resistant to adverse conditions and can survive for several years. So the infection occurs when the egg containing the infective rhabditiform larva is swallowed. So after the ingestion of embryonated eggs in contaminated food or drink or water, or from any contaminated fingers, host digestive juices act on the egg shell and liberate the larva into the small intestine. So they will penetrate the intestinal mucosa, enter the portal vessels, and are carried to the liver. Then after that, they then pass through the hepatic vein, inferior vena cava, and the right heart, and in about 4 days they will reach the lungs, where they grow and molt twice. Then after 10 to 15 days, they pierce the lung capillaries and reach the alveoli. So they will crawl up, or they are carried up the respiratory passage to the throat and are swallowed. So the larvae molt and develop into adults within the duodenum. So they become sexually mature in about 6 to 12 weeks, and the females start laying eggs to repeat the cycle. So the adult worm lifespan is around 12 to 20 months. So that is for the life cycle of Ascaris lumbricoides. Then next we have is the pathogenesis of Ascaris lumbricoides and the lab diagnosis. So the pathogenesis, there are two phases in Ascariasis. Okay, the infection or the disease caused by this parasite is known as Ascariasis. So they have two phases. The first one is we have the blood-lung migration phase of the larva, and the second is the intestinal phase of the adult worms. So in the first one, the blood-lung migration phase of the larva, during the migration through the lungs, the larva may cause pneumonia. The symptoms are low-grade fever, dry cough, blood-stained sputum, then asthma. Then we can see large number of worms may give rise to allergic symptoms. So eosinophilia is usually present in this case, and the clinical manifestation is also called as Loeffler's syndrome. So the next, intestinal phase of adults. Here the presence of few adult worms in the lumen of the small intestine usually produces no symptoms, but may give rise to large abdominal pain, and you will see a heavy worm burden can result in malnutrition, especially in case of small kids. Then wandering adults may block the appendiceal lumen or the common bile duct, and even perforate the intestinal wall. So thus the complications of Ascariasis, such as intestinal obstruction, appendicitis, then biliary ascariasis, we have perforation of the intestine, and pancreatitis, etc. may occur. Then coming to the lab diagnosis, out here we will have detection of parasites. We can detect the eggs, the larva, and the adult worm by different methods. So in case of the eggs, you will diagnose the parasite in the feces. Okay, definitive diagnosis of ascariasis is made by demonstration of eggs in feces. So rarely when the infestation is light, eggs are demonstrable only by concentration methods. That is for the egg. Then coming to the larva, detection of larva in the early stage of infection. When migrating larvae cause Loeffler syndrome, the diagnosis may be made by demonstrating the larva in sputum or in gastric washings. So these are the samples that can be collected. Then for adult worm, detection of adult worm, this can occasionally be seen by naked eye in stool or sputum of patient, and we can also perform X-ray, barium meals and ultrasound imaging for the diagnosis, for the detection of the adult worm. Then other methods we can perform for detection of the parasite is the serodiagnosis and blood examination. In serodiagnosis, the Ascaris antibodies can be detected by again different methods like ELISA, IHA, IFA. So all these diagnostic tests is helpful in extraintestinal ascariasis like Loeffler syndrome. So for blood examination, if we perform, you will see eosinophilia in early stages of the infection. So that's all about the lab diagnosis of Ascaris lumbricoides. Then the prevention and treatment. What are the prevention can be taken, or the prophylaxis? Here, treatment to this infection or treatment to ascariasis, we can take mebendazole, albendazole, etc., which are effective. Then for prevention, we can do like elimination of fecal contamination of soil, then health education and hygienic habits. So basic things matters a lot. Thank you.